Hello, I'm Dr. Mark Porter and thank you for downloading this edition of Inside Health. I hope you enjoy it. What do Vikings, bloodletting and iron fists have in common? Don't worry if nothing springs to mind. The medical condition linking them all tends to catch out most doctors too.
The mean delay to diagnosis from the beginning of potentially related symptoms, the condition is 7-8 years. And that's a problem and very irritating, very uncomfortable, clearly, for patients.
All will be revealed later in the programme. A listener emailed insidehealth@bbc.co.uk to ask about hemochromatosis, a condition caused by iron overload and one that's all too easily missed by both patient and doctor. Yet close to 500,000 people in the UK could be affected to some degree. Might you be one of them? Tim Cox is Professor of Medicine at the University of Cambridge.
Hemochromatosis, first given that name by a German in the 19th century, does have a strong genetic predisposition with a gene that you need 2 doses of to get the condition, which is at a very high frequency in Northern Europe and is believed to owe its origin to the Viking invasion of Northern Europe and is a kind of European disease. It's most frequent, in fact, in Ireland. About 1 in 100 people. That's a very high frequency indeed. But it's comparable in other parts of America and Australia and New Zealand and other parts of the world. The nature of it is the excess accumulation of iron in the body causing injury to many tissues, and iron has very special properties. We need it, we fastidiously conserve it normally and only absorb from the diet exactly what we need if we can get it from the diet. In excess, however, for the very reason that it's essential, it is toxic. And when it accumulates too much, then it causes injury by reacting with oxygen and, in so doing, damaging particularly the liver, the endocrine system, occasionally the heart, also the joints, the small joints of the hand in particular. And the endocrine system, by that I mean it damages the pancreas, causing diabetes, and it may affect the pituitary gland, the conductor of the endocrine orchestra, if you will, and particularly affects, in the early stages, the gonadal system. So the hormones that drive the gonads, the testis and the ovary, those hormones can be deficient. An almost universal symptom is a fatigue, tiredness, and they develop pigmentation of the skin, and the classical cases were called bronzed diabetes as an effect of iron on the skin.
My name is Philip Perver, and I was diagnosed with hemochromatosis in 2002. I first noticed there was a problem where I noticed there was some tanning on my skin, where pigmentation of my legs actually went brown. And we'd been on holiday in France in 2002, and I was fit, I was doing a lot of sport, I felt very active. But I just came back, and my wife turned around and said, "You always seem tired at the moment." And I thought, something's not quite right. So I went down and saw my local GP, explained the situation. And he'd had a patient a few weeks before who he diagnosed with hemochromatosis. And as I was describing my symptoms, he said, let me just check something here. And he took some blood tests. And a week later, I went back and he sat down and said, "Yeah, we've got a slight problem here."
Had you ever heard of hemochromatosis?
Never.
Looking back now, with the benefit of hindsight, how long do you think this had been causing you problems for?
Do you know, I'm not sure. I think if you spoke to some of my friends, they would say from university, "Phil's always tired." Then I'm just so grateful to my local GP, because my understanding is normally one doesn't test for hemochromatosis.
Well, you have to do a specific test to find it, and if you don't think of that...
So I'm very grateful to him.
And to the patient who went before you, presumably.
Yes, exactly. Yes.
The classic history is, I'm afraid, a rather difficult one for doctors usually to put together. Many of us are tired. It's a bit of a heart-sink complaint, I have to say. If you ask 100 medical students to put up their hands, if they can get their hands up, you might just about see 200 hands to say who is tired today. All these aspects, sometimes the heart disease with the irregular rhythm, the liver, the pigmentation, the diabetes, the fatigue, these are not put together really, and they don't immediately jump out, as it were, of the page and make sense in a rushed clinical consultation.
The real push is really for earlier diagnosis.
Dr. James Dooley is a consultant liver specialist at the Royal Free Hospital in London.
The mean delay to diagnosis from the beginning of potentially related symptoms, the condition is 7-8 years. And that's a problem and very irritating, very uncomfortable, clearly, for patients who feel they've been not recognised earlier or missed, you might say. But there is classically a delay until it's picked up. The way it comes, very often the iron tests are done looking for deficiency because it's tiredness patients have, and then it's a surprise generally when it comes back high. Left without being recognised over years, silently, patients can just develop cirrhosis or other features later on, joint problems, particularly it's the knuckles get affected. And there's a typical one in the severe patients where it's called an iron fist, because the patient cannot form a fist.
Once you make the diagnosis, how do you manage it?
In the vast majority of patients, it's removing iron by taking blood from them.
The really great thing about this condition is that in the early stages, at least, it's intensely treatable. We do know that. It's one of the last indications to venesect or do phlebotomy. It's almost medieval, to drain blood from the forearm there at the elbow, 1 pint every week or two, for sometimes months or years, a couple of years in some cases where the iron excess is very high. It is a little primitive, but it's very effective and hugely health improving.
When I had my results in November 2002, I was immediately asked to go down to one of the units to go and have a bloodlet. I had about 34 bloodlets within 40 weeks to reduce my level. During the first few weeks, because they were draining the blood from me each week, I actually found I was very, very tired from it. But once we were through that and the iron level was down to the level that we'd set as an agreed target, I just felt fantastic. I had so much more energy. I'd felt like I hadn't felt in years. And my wife commented, she said, "It's lovely to have Phil back again."
A happy Phil Purver. And you'll find more information on our website. Just search for Inside Health and hemochromatosis, and it should take you straight to where you need to go, assuming you can spell hemochromatosis.